One of the features of the American economic system is competition. We believe in it so devoutly that we have laws that, with criminal penalties for anybody who tries to monopolize a market. And yet in the healthcare sector, things seem to be different. We have candidates running for president who say they want to create monopoly in the area of health insurance. So it'd be only one insurer. So why does anyone think that monopoly would work in healthcare better than it works anywhere else in the economic system? And part of the answer is that in the private sector with private insurance, we're not getting the benefits that we get from competition in other markets. And in this new editorial at Forbes, I explain the 5 deadly sins of private insurance, but let's just start with the most important. You know, when you go to a food court, what do you see? You see variety and you see specialization. You see one outlet specializing in Chinese food, another Italian food, another makes hamburgers, another makes chicken. And you wouldn't think that the Chinese food outlet would be very good at making Italian food or hamburgers or something else. People specialize in a product, they get good at it, and that's why you go there. But imagine that we had a law that said that you can't specialize, that the Chinese outlet has to serve Italian food and hamburgers and chicken and every other kind of food if that's what customers want. Well, what would you get? You would get mediocrity. No one would specialize and get good at anything. People would be serving mediocre portions of anything consumers happen to order. Well, that's what we've done with the health insurance marketplace. We have outlawed specialization. We insist that health insurers be all things to all patients. Just to take an example, many of you have seen Cancer Treatment Centers of America advertising its product on TV. They specialize in cancer care. They think they're quite good at it. And if you have cancer, they want you to come to their hospitals. But they're not in the Obamacare exchange, and they're not in the Medicare Advantage program anywhere, and they're not in typical employer programs. So why not? Because in the rest of the healthcare system, we don't allow any plan to specialize. We don't allow plans to specialize in cancer care or diabetic care or heart care. And that means we don't have focus factories. We don't have health insurers who get good at what they do. And we've done something else. We've made it almost impossible to get the right patient with the right plan. And that's because before you enroll in a health plan, the plan doesn't get to ask you questions about what your needs are. And you have no opportunity to tell the plan what your needs are. So even if some plans were much better than other plans, say at heart disease, there's no way for the plan to tell the patient about that fact. And there's no way for the patient to tell the plan what his healthcare needs really are. And to make all this even worse, once you get in a plan, let's say you've made mistakes and you enroll in the wrong plan, we don't have any way for the plans to get together and trade and send the patient who's in the wrong plan over to a plan that can do a better job. This is just a short beginning of a long series of mistakes we've made in the health insurance marketplace. And if we want to correct these problems, we need to get the regulators out of the way, allow the market to work, allow people to specialize and get good at what they're good at, and allow patients to know what plans are best at meeting their needs.